anybody could see here, there's something wrong with this leg.
It's broken.
It's broken, right?
Yeah.
Okay. So it is definitely broken.
Broken big time.
And it has a really big story with what happened to this patient. This is actually the first set of images when they came in. I'm just going to show a quick thing over here. It was actually open. It was open when it was broken. So what happens is there's a big risk. You know, definitely we need to get these images as quickly as possible when we work in emergency situations. There's no time just for perfecting our images, but we should know how to have an almost perfect image. This person had a long history. His bone got infected, and it was terrible. What happened? What came forward after?
You took this X-ray?
These ones, no. I did take after the bone was infected. I had the X-rays, but I didn't want to show it because it's really it was really ugly. Because I didn't know, it's really sad. What happened is that basically the bone, they tried to fix it in surgery, and it just wouldn't heal. It would heal instead of the bone growing. Because what happens is when they want to fix this type of fracture is that they will put like a long nail in the bone, in the long bone, and usually should start healing around where the fracture is.
A nail or a screw?
It depends. This one they will put a nail.
يعني شاكوش؟
شاكوش ايه بالشاكوش بالنيل. بس هو نايم اشعة سوى. هو مكسور.
مو قاعد.
So they'll put a nail and it should heal. It should heal around it, but basically the bone wasn't healing properly, just accumulating over it instead of healing up and down. I should have included the images. Okay, so enough with X-ray. Basically, the medical imaging field is a lot more than just X-ray. You start off basically with X-rays, and then you could get extra training, and you could go on with different modalities that we have also. Right now, I just left X-ray training, and I'm getting trained in CT scan. So CT scan and MRI, they give the same images, but I want to see if anybody knows the difference between the two. Yeah.
CT scan is for the head.
Okay.
MRIs is for muscles and like anything that is non-bone. I think so.
Okay, the MRI part is right. Technically, we can still do some bone studies on
ligaments and muscles and things like that.
Yeah, it's very good for muscles and ligaments, anything that is not bone, like you said, because with it uses, our body is mostly composed of hydrogen, of water, right? And the MRI uses a lot of it calculates with the hydrogen, but the MRI, because technically the CT scan you can still do it for other parts of the body, but the main difference is that MRI gives you the best pictures, and CT would give a little less better quality images. And the CT uses radiation. We use radiation, and MRI does not use radiation. But the comeback with that is that MRI, we have, you know, if you have a piece of metal in your eye or something, just forget about it, because the magnets will pull it out of your eye, and we can't let that happen. So that's also a duty of a tech. You know, you have a whole questionnaire. We're going to make sure that you're completely safe to go on with an examination.
What does it stand for?
CT?
Yeah.
CT is computed tomography.
And the MRI?
Magnetic resonance imaging. So they produce, like I said, it's a bit more complex now because you got to learn a bit more anatomy. You don't imagine just, let's say, the bone or any other structure of the body as it is in front of you. Now we got to start looking at it as if you're slicing a piece of meat. So I'll take, it's a bit brutal, but taking somebody's body and just cutting it into pieces, you know? And that's how you got to start imagining the anatomy of the person. So it's like slicing and looking at the person from top, you know? So that's why it's a bit more precise in diagnosis. Another service also that's offered in radiology is called angiography. What it is basically is it's studies of the vessels, so your blood vessels, veins, arteries. It's very good also if you have, well, if there's any aneurysms in the brain. We used contrast, a liquid iodine that we inject in your vessel to highlight your vessels. So if you can see, this is the same guy that got his leg fractured. I think that's his other leg. But yeah, this is his other leg. So we inject the contrast, they would see whether there's any more blood supply towards his leg. But they did both legs on this guy. I didn't have the other set for him. At the same time, there's also, it's treatment, it's very good also for cardiac surgery. Instead of doing open heart surgeries, we can go directly into the vessel in your heart that's clogged or that's almost going to cause a heart attack, and put a stent, put something that will open up this artery and send the blood to your heart. Are you guys okay? Understand what I'm saying? No? Okay. Okay. So it's basically, I'm going to say in more very simple terms, radiology, as a technologist, we use any different machine to get, instead of opening up your body to see what's wrong, we can just, directly, without opening, without any harm, we can just see what's in your body, what's wrong with you. That's the main idea. It is just different types of machines we're using. I think I'm going a bit more detail, so I apologize. This is the most fun part, the surgery room, operating room. I took this picture, I tried to get a good angle of it. I'll just show everybody.
You took this picture?
Yeah.
You're allowed? I mean, it's not confidential?
Okay, who knows who's inside?
I just want to show what we have. So this is our, can everybody see this little screen right here? Yeah. This little screen? Okay, so this is our X-ray screen where we get our films directly. Our images, our films. We don't use film anymore here. And this is my X-ray machine right here. So they're operating, these are surgeons, they're operating on the person's leg right now. And while they're operating, we need to take X-rays. They have to see if they're in the bone correctly, or they need to do any adjustments, if the movements are correct after the surgery. I love the operating room. If you like blood, you go there. So how do we work together? Me and Mohammed, which we see each other once in a while. We do, our blood analysis is very important for some exams. I'm talking right now in terms of X-ray because that's the most experience I have, and in CT. We need white blood cells. That helps us know whether, if there's a break, if there's an infection within the bone. We also need red cells and platelets, all the blood counts. At the same time, we need to see how your kidneys are functioning. We do kidney studies also. And lastly, it's very important that if a woman is pregnant, that is a big no-no for X-rays, unless it's very urgent. So that could be confirmed with blood test. And for those who think, I just put this up because I even get this from some people in the hospital that, we push buttons, that's our job, but it's a bit more complex than just pushing buttons. And here's some admission criteria. If you want to know, you go on the Dawson website. And that's it. Thank you for your time.
So basically just concluding the whole idea. So you saw the kind of complexity that comes when someone gets sick or get an injury or get any medical issues.
Or dislocation.
Or dislocation.
Yeah. We take X-rays for that too.
So those complexities that is in the body, and we know that the body is limited. If we go to the soul, and the soul is unlimited, so we could understand the relationship. There's a complex body that is limited, so the soul must be complex also, because it's kind of limited. So how could we measure our souls, or the strength or the healthiness of our souls? We know that the soul is infinite, and it comes from Allah subhanahu wa ta'ala. So our relation with Allah subhanahu wa ta'ala would allow us to measure how strengthful is also. So while prayer, is there any connection with Allah? So this is a measurement tool. If we guys pray and we don't have any connection, we have some things to deal with. We're kind of sick in terms of our souls. If we do dua, it's kind of a healing procedure. It's like giving you a pill. Do dua, you're kind of talking to Allah and trying to address your needs in the dua. So it's like a treatment. It's like a medication. Let's say if you do amal salih, and this amal you try to put the intention to Allah subhanahu wa ta'ala. That's also a treatment. Because everything that you do in life, and if you put everything in life into the perspective of Allah subhanahu wa ta'ala, you're going to feel that your interaction between Allah and yourself. So think about that complexity. Think that you need, and we all need, to work on our souls as much as we need to work on our bodies. We do exercise, we go to the gym, we treat our body, yet we need to also to treat our souls. So in order not to get sick while treating it. One issue of the soul, when you want to know more about how sick you are, how healthy you are, where are you at, you need to know yourself. And knowing yourself is knowing your virtues, and you knowing your vice. Knowing, let's say, am I saying the truth all the time? Truthfulness. Am I doing some ikhlas to Allah subhanahu wa ta'ala? My intentions are they all for Allah? Otherwise, this is how we measure our souls. In terms of iffa, do I get lost in terms of, let's say, looking at the opposite sex in terms of lust or not? These are all measurements. We have to know ourselves. We have to measure ourselves, knowing how much we have this balance in our virtues. So basically, this is just a kind of introduction. I don't want to go into details into it. We have to spend at least 15 minutes to explain. Now we're going to go to the last part.
If anybody could see here, there's something wrong with this leg.
It's broken.
It's broken, right?
Yeah.
Okay. So it is definitely broken.
Broken big time.
And it has a really big story with what happened to this patient. This is actually the first set of images. And, you know, it's really sad what happened. Is that basically the bone, they tried to fix it in surgery, and it just wouldn't heal. It would heal instead of the bone growing, because what happens when they want to fix this type of fracture is that they will put like a long nail in the bone, in the long bone, and usually should start healing around where the fracture is.
A nail or a screw?
It depends. This one they will put a nail.
يعني شاكوش؟
شاكوش ايه بالشاكوش بالنيل بس هو نايم اشعة سوى هو مكسور
مو قاعد.
images when they came in. I'm just going to show a quick thing over here. It was actually open. It was open when it was broken. So what happens is there's a big risk. You know, definitely we need to get these images as quickly as possible when we work in emergency situations. There's no time just for perfecting our images, but we should know how to have an almost perfect image. This person had a long history. His bone got infected, and it was terrible. What happened? What came forward after?
You took this X-ray?
These ones, no. I did take after the bone was infected. I had the X-rays, but I didn't want to show it because it's really was really ugly. Because